Changes in chromosome can lead to miscarriage or development disorders. Changes in chromosome number can occur when homologous chromosomes do not separate normally during meiosis. This is called non-destruction. Also, if a person has an abnormal number of a particular chromosome called aneuploidies. Some genetic disorders that have resulted from changes in chromosomes are Klinefelter's syndrome, Down syndrome, Patau syndrome, Turner syndrome, and Edwards syndrome. A normal human has 46 chromosomes.
Klinefelter syndrome is a sex chromosome disease only affecting the male physical and cognitive development. This disease has an extra X chromosome. It is caused when a pair of sex chromosomes fail to separate during the formation of an egg or sperm. This is referred to as a non-disjunction. People with this disease are often tall and usually don't develop secondary sex characteristics, such as facial hair, underarm hair, and pubic hair. The extra X chromosome affects the testes, which produce sperm and the male hormone testosterone.
Turner syndrome. A sex chromosome, missing or incomplete sex chromosomes, only affects girls and women. Turner syndrome can cause developmental problems, including short stature, failing to begin puberty, infertility, heart defects, and certain learning disabilities. Symptoms are an especially wide-necked or web-necked and a low or indistant hairline, a heart murmur sometimes associated with narrowing of the aorta, blood vessels exiting the heart. Scoliosis. Older or overweight women with Turner syndrome are slightly more at risk of developing diabetes.
Down syndrome, also known as trisomy 21. It affects the autosome since there are extra chromosomes 21. It also has effects like having eyes that have an upward slant, low muscle tone, small stature, and short neck, flat nasal bridge, single deep creases across the center of the palm. Down syndrome occurs in 1 out of 800 live births in the United States. It can affect all race and economic groups.
Patau syndrome, also known as trisomy 13, is a disease that affects chromosome 13. There is an extra chromosome 13 in a person with this disease. It is a chromosomal condition associated with several intellectual diseases and physical abnormalities in many parts of the body. Individuals with trisomy 13 also have heart defects, brain or spinal abnormalities, poorly developed eyes, extra fingers or toes, an opening in the lip, or weak muscle tone. Many infants with trisomy 13 die within their first year or the first days of life. Some people with trisomy 13 only have an extra copy of chromosome 13 in some of their body cells. This condition is called mosaic trisomy 13.
Edwards syndrome is a change in autosomes. A person has a third copy of material from chromosome 18 instead of the usual 2 copies. Edwards syndrome is 3 times more common in girls than boys. The syndrome occurs when there is extra material from chromosome 18. The extra material affects normal development. Symptoms as followed: low birth weight, crossed legs, low set ears, mental delay, small head, small jaw. It is also called trisomy 18.